When you first came to Clinimed, we discovered the signs of insulin resistance, such as acanthosis nigrans. How did you, finding out about the medical aspect of your obesity, or rather insulin resistant, make you think about your journey and the reasons why you wanted to do this so bad? How did that change as you went on?
Firstly, let me be honest. Before I stepped foot at Clinimed, I knew nothing about insulin resistance. And with that being said, I've always been someone that has battled with hyperpigmentation growing up all of my life. I had a conversation with Dr. Masenga about this, where my mom actually caught me with detergent trying to clean my neck, because the whole time I thought it was dirt. You know, it's so sad trying to scrub off something that can't come off.
That is not even your fault.
That is not even my fault. You get what I'm saying? And only now, 7 months later, to fully understand that it was actually part of the symptoms showing my insulin resistant and actually being borderline type 2 diabetic, which we've reversed now successfully. I'm confident in even wearing my clothes. I don't have to hide behind everything, because my neck was literally my main insecurity. I would get dressed and look beautiful, but I used to hide my neck behind hair or behind clothing, because it really does something to you as a person. You know, your body and your face being the same shape, but then your neck is completely dark. And you know how nasty people are? They would point it out like, well, when's the Gandoni? And you know, amongst us, it would be like, oh, I didn't say it, but it was never the case. And now only I understand that it was actually
part of the insulin resistance that you had.
Exactly.
And what other symptoms did you say you experienced pertaining to that, apart from the darkness of your neck? Were there any other things that you had that are kind of disappearing, that you're like, oh, I no longer have this, I used to struggle with this? I know for me, I used to have a lot of joint pains. Like, I was stiff in the morning, and I was like, okay, you know, I'm in my 40s, and I'm like, huh? Maybe I'm in that age. Is this what our parents were talking about? And you know, it's those little things that literally just disappear, and you're like, I'm no longer stiff, I'm no longer short of breath when I go up the stairs.
Do you know, climbing up the stairs, I look forward to climbing up the stairs. Things like tying my shoelaces, I look forward to tying my shoelaces. You know, I can even reach my back when I wash. I could never reach my upper back. That was something that I used to dream of. So, you know, being just able to do normal things, what the next person would deem normal. And you would only understand these things once you actually the fat girl. You know, even now, there's so much subliminal, I will call it bullying when it comes to being fat, because even like when you're traveling with friends, oh no, you can go in the front seat. Ish. That's like a young blow reminding you that, oh, you're the fat ones. Like, we're gonna sit comfortably in the back, but now you need to sit in the front, because.
And how it becomes your identity.
It does. It does.
And somewhere, yes, it bothers you, but there are instances where you need to normalize it and make it like it's not a big deal, you know.
And plus, also being the fat girl, it's like always the jokes. You always need to be funny, and it's like always you just need to laugh things off. And I'll tell you one thing, Doc. I'm not where I want to be weight-wise, right? But compared to what I used to be,
a big difference.
I'm just saying, right? But the point that I want to get to is that the treatment that I'm getting now, compared to the treatment that I used to receive when I was 120 kilograms, 85 kg Tina is totally different.
What do you mean by that?
Even compliments, even people just being nice. There's
Are these people that knew you before?
with strangers and people that knew me before.
Okay.
It's like there's just this. You just get treated much nicer.
Don't you think it's also because of how you feel about yourself? How your confidence is just full on,
Mm-hmm.
and you are just in your space where you feel that, you know what, I'm feeling myself
Yeah.
more than anything.
That could definitely also be part of it. But I also feel like with what I was stating with the subliminal messages or tones, because automatically when you obese, you associated with being lazy. You are associated with being dirty. You are associated, like all of the negative things that, or negative connotations that you can think of. That's what you're associated with when you're obese, without you even saying anything, without the person not even getting to know you or seeing what type of individual that you are. It's just something that's unsaid that happens.
It's so sad because when we do more research as doctors, it's coming out clean and clear that obesity is not anybody's fault.
Yeah.
It's actually a disease, just like hypertension, just like diabetes, and the more we understand that, the more our approach changes completely
To everything.
Yes. Because
Yes.
I mean, I have patients that literally break down and say, you don't understand where I am mentally and psychologically, because being fat has been such a burden for me. And I've been there because I've tried to gym, I've tried to do this, I've tried to do that, and it didn't work. And also because there are so many other factors. It's not just about don't eat less and move more.
Yes.
It's not
No.
like that. There
And
are other
that's-
factors
and
that
that's-
are involved.
That's the one thing that I love and appreciate so much about CleanMed, because not only did you guys educate me about my own well-being, but is to understand the whole
weight loss.
exactly. Because with that being said, I've tried gyms, I've tried diets, none of them worked. Guess what? They couldn't work because I had underlying conditions. Even if I wanted to, my body wouldn't allow me to lose the weight because I was insulin resistant. I had PCOS. I was borderline type 2 diabetic. My hormones were imbalanced. And what you mentioned about my thyroid. So even if I ate well, even if I all this discipline that people say, oh no, you're just not this, oh no, you're just
not
lazy.
disciplined enough.
No.
It's
There's
not
none
like
of that. And I'm so glad that in the time and age that we are living in, we understanding it more, that it's actually a medical condition, because it literally means that your body's not working in its full form.
Capacity.
Hence, you need medication to assist you. But with also that being said, I know this is a mouthful. Medication needs assistance as well. You can't just come have a jab and then still go eat junk.
That is something that I wanted us to delve into.
Yes.
Because a lot of people out there, they think, no, people who go on jabs, they just jab and they live their life. They eat whatever they want, they're lazy, they can just jab and go on with their life. What are the things that we have mentioned here in CleanMed that, you know, one thing I like about many of our patients, and once they lose weight, it's just that spirit of you feeling like yourself and wanting to be active.
Yes.
Because that's something that we encourage from day one.
Yes.
To say that, you know, this is something that you need to make it a part of your life. So how, looking at yourself now and looking at yourself back then, how would you say you are working out more, or how?
I definitely am. So, with having a jab, the jab definitely works. We're not going to run around that. But you need to ensure that your muscle is also increasing. You know, So personally, I used to walk, and walking did it for me. I was doing 10K steps a day, and then with the weight loss, I saw that it doesn't necessarily build your muscle so that you can get into a shape that you want to be when you lose the weight. And that's when I joined Pilates, right? So I'm doing Pilates 4 times a week now. And with Pilates, you feel it. It works your full body. So this is not just a weight loss program. I want us maybe to drive away from that, just to say or rephrase and say that it's a lifestyle change. Because now me eating healthy, me being active has become a part of my lifestyle. It's something that is normal. To me, like when I wake up in the morning, it doesn't make sense that I just sit in bed and not do anything. Like it has become a norm.
And on that note, this brings on the point to say, if one is on a program that does not have structure, you will lose the weight.
Yes.
And losing the weight is not just about losing weight. There's body composition that comes in. That's where we look at your muscle, we look at your fat, we look at your water.
I learned that the hard way. Remember how I used to be like, oh, but why isn't the scale moving? And you'd be like, listen, your muscle is heavier than the fat. When you gain muscle, the scale won't always move. And that's when I was able to restructure my thoughts regarding the scale.
And you know, I think where we are now, we've been there before.
Yes.
It's just that somehow we are starting to forget. Remember?
Yes, we definitely have.
We definitely have been there.
Because it's not just about scale victories.
Yes, it's about the small.
There's non-scale victories that come with losing the weight that make you feel so liberal. Without the numbers. Yes, we love the numbers. I'm not gonna lie, we definitely love the numbers.
I definitely agree with you.
But going into the shop and being able to just take a size without going to the fitting room and having it fit on, you know,
It's amazing.
that's definitely a victory for me.
It's a definite victory. I always say to patients that remember, you don't wear the scale.
Yes, you
You
don't.
wear your centimeters.
And that's why I get inboxes every day. Please give us your old clothes, please give. And I'm like, no. Because my testimony becomes even stronger when I appear wearing the same dress but 35 kgs lighter. Then you actually see the difference. So I'm not in a rush to give away my clothes or to sell my clothes or whatsoever, because it gives me another chance.
Excitement.
Yes.
To dress in that clothes and be like,
Exactly.
oh, check how
Look
big
at
this is.
this.
Look at this, it's so loose, it
You
used
know?
to be so tight.
Exactly.
Yeah. No, I definitely agree. Okay, let's move on to the next